Right now, county leaders are providing an update on the coronavirus situation here. Let's go ahead and listen in.
The rest of their lives. And we don't want them to spread the disease to others, like older, vulnerable residents and relatives. That's why today we are joined by Dr. Scott Eisman, who is a pulmonologist from Scripps Hospital, who has seen firsthand the impacts of COVID-19. Dr. Eisman is here today to detail the health impacts this virus has had, especially on young adults. I also want to let you know that Supervisor Fletcher will not be joining us today as he has a family commitment. But Dr. Wooten is here to provide the medical update and go over the charts. So with that, let me call up Dr. Wooten.
Thank you, Chairman Cox, and good afternoon, everyone. Global, national, and stage-wide statistics are based on the data that we retrieve every day from the Johns Hopkins dashboard, which is obtained by noon each day. And you can see that information on this overall graph. Today, the statistics for the County of San Diego are from reports as of 11:59 p.m. yesterday. The total number of cases is now at 21,446, which is 559 more cases than reported yesterday, and includes 448 deaths, which is 12 more deaths reported since yesterday. In the next slide, this provides overall statistics and demographics for all of our cases. As a reminder, the age range of our cases is from 3 months of age to 102 years of age. 58% of the cases are in the age range from 20 to 49 years of age. So that's 12,474 individuals or cases. Again, 58%, which is slowly increased from about 50% since the beginning of the pandemic. 51% of the total number of cases are female, 49% are male. 2,093 or 10% of all cases have been hospitalized. Of that number, 546 have been admitted to the ICU. This number is 3% of the total number of cases and 20% of the total number of those hospitalized. Again, there are 448 total deaths, which represent slightly over 2% of the total number of cases. 109, if you can go to the next slide, 197 or 42% of those that died were female, 56 or 251 are male, and 425 or 95% of the total deaths had underlying medical conditions. 22 or 5% of the total deaths had no underlying medical conditions. And as always, our sincerest condolences and sympathies go out to those individuals that have lost their lives due to COVID-19. Now, in the next set of slides, we're going to share with you additional demographics related to testing, cases, and hospitalizations. In this particular slide, this shows the result of our T3 strategy: test, trace, and treat. We are well over our goal for stage 2, which is 5,200 tests, which is equivalent to 1 test per 1,000 population. And we have gone even over the stage 3 goal of 2 tests per 1,000 population. So we are, for July 14th, we had 8,436 tests completed, or a 7-day average of 8,056 tests. For trace, we have 511, or rather 13 staff that are involved in case investigation as well as contact tracing. So of this 513 total, 215 are case investigators and 242 are contact tracers, and an additional 56 are admin staff. And I'll talk more about the case investigators shortly when we talk about triggers. As it relates to treating, we have 73 individuals in isolation in our public health hotels. In this next slide, this complements the information that I just showed with you. This is the rolling 14-day average, which is the line at 6.3%. And for the total number of tests performed yesterday, 7% of that total was positive. Next slide. So this just supports the testing information that shows over the past almost several weeks the daily number of tests. So that supports the T3 strategy. And as you can see on the left side, we started slowly, continuously increased, and now again we are well above the stage 3 target of 2 tests per 1,000 population, which is 6,600 tests. In the next slide, this is our epidemiology curve, which shows the beginning of our first cases. And in the beginning of April, we basically had a plateau. We like to speak of that as flattening the curve. If we show the next slide, then as we began to open up more businesses, we are looking at the period after that where we began to see increased cases, and we recognized that we would have increased number of cases here. The incline of the number of cases is, however, dramatically higher than previous weeks. So we wanted to show how this has played out. In the next slide, this is a number of new cases. On the left is by week. And again, we can see that after mid-June, we began to see an increase in the number of cases. And on the right side is just the daily numbers that we will continue to follow. But in the past 10 days to 2 weeks, we have been consistently, with the exception of a couple of days, either between 400 and 550 plus cases daily. In this next slide, we wanted to really show how since May 25th, this is COVID-19 cases by age group and week of illness onset, which is more accurate in how we report our epi curve, date of onset of illness. And since May 25th, we have had 13,868 cases, and here we wanted to show, with the exception of the shaded out area on the right, because we know more cases will occur there as that is the incubation period, how our total number of cases in this time period have increased by age group. So we see that 20 to 39 years of age is the highest age group where we have seen an increase in the number of cases, followed second by the 40 to 59 age group, which is the green. In the next slide, this is COVID-19 hospitalizations among San Diego County residents. These are new hospitalizations by date reported. And also, since mid-June, we can see an increase in the number of hospitalizations. Going to the next slide. This is, if we look at any point in time, any day, since the beginning of the outbreak for hospitalization. This is all hospitalizations associated with confirmed COVID patients. We can see that again, since the mid of June, the numbers of hospitalizations have increased. And we shared that the increase is seen mostly in the 20 to 29 and the 30 to 39, as well as the 40 to 49 age group. Next slide. And this again is another rendition of hospitalizations by age group and week of hospital admission, again, since May 25th, and particularly since mid-June. Again, the increase has been seen across all of those three age groups that I just shared with you, 20 to 29, 30 to 39, and 40 to 49 age group. Here they are grouped a little differently than the way we report them on the table that was shown at the beginning. But still, the age range, particularly from 20 to 39 and 30 to 39, and from 40 to 59 are the highest age groups, with the aside of 60 plus, which is the highest, but we see the increase in the younger age groups below that. Next slide. So now I would like to move into our triggers. So this slide has the consistent 3 triggers that have been abnormal for the past week to 10 days. And trigger number 1 is associated with case rate. This is the trigger that gets us on the state's monitoring list. And if we will go to the next slide, it shows how we have progressed from July 9th up to the 15th. So again, this is what the state monitors. This is available, can be found on their website, where they compare all counties to each other. Next slide shows information about outbreaks. So this is trigger number 2. And the target is 7 or more outbreaks in the past 7 days. And as you can see, in the past 3 weeks, we have continuously seen an increased number of outbreaks. And today, our target, if the next slide, is we have 14 outbreaks in community settings. And in the past 7 days, we have a total of these 14 outbreaks. And this slide and the next slide shows the category and breakout of the various locations. And these are the 4 newest outbreaks reported and confirmed as of yesterday. We have 1 in a laboratory, 1 in a hair salon, 1 barbershop, and 1 in a restaurant/bar. In the next slide, this shows or is related to trigger number 11, which is related to case investigations. And the target here is no less than 70% of all cases reported are contacted, or contact is initiated. And we thought after that number was declining to 57%, we were on the upswing, but started to decline again because the numbers are continuing to increase. Today we issued a job announcement for staff to come on as case investigators, and after only 3 hours, we had over 300 applications received. So we anticipate that bringing on onboarding and training these staff that are hired will improve this particular trigger. Next slide. And lastly, we want to encourage everyone to practice good hand hygiene and sanitation, to keep their distance 6 feet apart, wear face coverings, and avoid crowded places, and to also stay at home if you're sick. That's a very important factor, and we want everyone to adhere to that. Adhering to these strategies will help to decrease the spread of COVID-19. So now I would please welcome to the podium, I'd like to introduce Dr. Scott Eisman, who will talk to us about hospitalization of our younger population with COVID-19. Dr. Scott Eisman has been practicing medicine in San Diego since 1990 and is board certified in internal medicine since 1985, board certified in pulmonary medicine in 1988, and board certified in critical care medicine in 1989. So he is a definite expert from Scripps Healthcare to talk about this issue. Dr. Eisman. Thank you.
Good afternoon, and thank you for asking me to come and talk today. As we've heard from Dr. Wooten, the incidence of this problem is increasing dramatically, and the ages of people that it affects are now changing as well. We've clearly seen that in our own practices, that we have younger and younger patients showing up with more and more significant complications, and it's certainly true that the mortality rate for those that are younger is lower than those that are older. But it's also true that the mortality rate is not zero. And it's also true that this disease is impactful not only because of the possibility of dying, but that's bad enough as it is. But I think what is really fundamental is to understand the differences in this illness compared to what we think of as a flu, for example. I know many younger people think that this is something that you'll get and you'll overcome and everything will be fine. But the complications of this illness are far greater, they're much longer lasting, and they're far more serious. And so I think it's very important for the public to hear how these things are different. And we know that COVID-19 affects the lungs differently than just the flu. Not only does it affect the little air sacs in your lungs that we call alveoli, but it affects the blood vessels in lungs as well. It causes blood clotting in general, not just in the lungs, and that can create very substantial problems with the ability of the lung to deliver oxygen. It's much, much more profound, much more rapid than we typically see in influenza. And let's remember that at least we have some therapies and an effective vaccine for influenza. We do not have that as much for COVID-19. We know that smoking increases the chances that if you do contract COVID-19 and if you develop pulmonary complications, that those complications may be more severe. There's good evidence that that is also true for vaping, not to mention the fact that we would have a hard time distinguishing what type of lung problem you have because vaping can cause its own lung disease as well. And we've seen a number of cases of that as well. Besides pulmonary disorders, in breathing disorders, I think one of the really important things to understand about this illness is that it's not just limited to the lung. It causes neurologic disorder. We now know stroke is described in young patients as well as older with COVID-19. Difficulty in thinking, weakness. We know that there are effects on cardiac function in terms of heart failure and irregular heart beating. We know that there are complications with the kidneys, blood system, liver, and those complications may be much longer lasting than people have recognized. We don't really know at this point exactly how this will play out because the disease is too new. We do know, though, I can tell you of a patient that we saw about 6 weeks ago who was a young man who came to the hospital, 40 years old. His wife and his brother-in-law were both infected as well. They all lived together. And he spent 45 days in the hospital, most of which he was on high-flow oxygen and laying on his stomach to help improve the delivery of oxygen into his bloodstream. So for a month and a half on his stomach. And I think if you're a 30 or 40-year-old individual, you have to think of what that would be like to your life and how long it would take to recover from that. Being weak, not eating well. We know, for example, from the experience in China during the SARS virus, the initial SARS virus in 2003, that studies showed that patients had a significant decrease in their lung function for up to a year after that and longer, particularly those patients who had severe pneumonia. So we think that it is likely this disease will be at least as bad at that, if not worse. The same was true of the MERS viral illness, all of which are coronaviruses. This virus seems to be much, much more aggressive than those two viruses. And we know from clinical experience that recovery can be very protracted. People take a long time to return to work, to get their strength back, to even to think properly, because it does affect your ability to think and reason and remember. I don't think I can really overstress the importance of trying to prevent the illness. I think if people feel that this is something they can contract and it's not going to be a problem and not going to be a serious thing, then they're not as motivated to do the things to prevent illness, such as distancing and hand hygiene and wearing masks and avoiding crowds, avoiding crowded places such as restaurants that are very tightly packed. I know in Encinitas, 2 months ago, a month and a half ago, I was driving down 101 and it was very packed. And now we see, not but a month or so, 5 weeks later, a spike in the frequency of the illness. I think if people will take those precautions to heart, hopefully it will avoid having a very serious illness for people. And although I know it's tough to avoid being out among everybody, it's much tougher to contract the illness potentially, and potentially fatal. Dr. Wooten? Chairman Cox?